Good afternoon, everybody, and welcome to this Contact an NNPCF webinar. Today we're doing it in conjunction with colleagues from NHS England, who I'll introduce you to in a moment. Before we get any further, some of you may know me. My name is Marunal Sisodia. I'm one of the co-chairs of the National Network of Parent Carer Forums, and I'm also the East of England Steering Group member. So today's webinar is about the NHS England Learning Disability and Autism Key Working pilots that are being launched over the coming months. The webinar is due to last for about an hour. We would like it to be as interactive as possible. And Kate, if you could log us onto the next screen. What we will try and do is we will try and take questions at the right time, so that you will see on your bar that there is a little question mark or questions tab. If you can pop your questions into that, write them in there, what we will do is I will pick them up as we go, and at the right point in the webinar I'll try and pose those questions to Mary and Kate and hopefully get answers for you. We would like this to be as interactive as possible. So please do ask your questions. Please do put your comments on there. We'll try and respond to as many as possible. Now, some logistics about the day. This is a webinar, and so all of the attendees, apart from Mary, Kate, and myself, will be on mute, and so you won't be able to. We won't be able to hear you. So that's why it's really important to use the questions and comments bar. Please bear with us if we do have any technical hitches, because we are actually broadcasting from, in this COVID world, from 3 different locations, and the wonderful Helen, who administrates the webinars, is in a 4th. So please do bear with us if we do have any technical issues. Hopefully we won't. And without any further ado, I think I'm going to hand you over to Mary and Kate to introduce themselves and take you through the webinar.
Hello everybody, and welcome to the webinar. My name's Mary Busk, and I'm a Senior Family Carer Advisor in the Children and Young People's team in the Learning Disability and Autism Programme at NHS England and Improvement.
Hi everyone, I'm Kate Sutton, and I'm also from the same team as Mary, Children and People's team in the Learning Disability and Autism Programme. And my role in the team is to lead on the development of the key working commitment to the long-term plan.
So we're really delighted to have the chance to talk to you today about this really important commitment for families and for children and young people with a learning disability, autism, or both. So we have a number of slides. That's, if you hear some noises, that's my son slightly screaming, but it'll be okay. So we have an agenda where we talk about what the long-term plan commitment actually was, the process and how we went about developing the key worker model, what families told us, the impact of COVID, and we have a discussion as well about the key worker function, the key worker role. We'll cover timelines, and we've got contacts for you, as well as a really important question at the end to ask for your views and input on. So the long-term plan commitment, the language was very clear in relation to the key working commitment, that it is for young people and children with a learning disability, autism, or both. It also specifically, though, relates to initially, it states key worker support will be provided to children and young people who are inpatients or at risk of being admitted to hospital, and by that we mean inpatient mental health settings. So we're very clear that the initial phase of this work is focused on that group of children and young people, those who are inpatients or at risk of being admitted to mental health in hospitals. And that language, just to go back, really, you know, came from, I don't know if you've read the Dame Christine Lenihan report, These Are Our Children, but this came from her work, and in particular focused on the needs of these children and young people and their families. So we've also, on another one of our earlier webinars that I did with Marunal about the long-term plan in the last few months ago, we also talked about the fact that co-production is an important part of the NHS long-term plan in relation to what it says for children and young people, that there should be local leadership, you know, to work in with across the NHS, local government, education and other partners. and in co-production with families, children and young people. Also, in relation to learning disability and autism, systems should involve people with lived experience and their families in checking the quality of care, support and treatment. So there's a very strong message in the whole of the long-term plan, as well as in this part, about the importance of co-production and working with children, young people and their families. Also, I haven't put all of these, or we haven't put all of these links in, but these are documents and national guidance that are all on our NHS England and Improvement website. And so over a period of years, all of these have been published to set out what good looks like in enabling out of hospital or mental health hospital care, and what care education and treatment reviews and dynamic support registers should look like in local areas. And really all of this is designed to make sure that children and young people get the right help at the right time. And the care education and treatment reviews have been really positive and important in doing that. A large proportion of those in the community ensure that children and young people and their families do get the right support in the community. And the dynamic support registers held by clinical commissioning groups have a vital role to play in ensuring that those children and young people who need lots of person-centered care and support and their families are known and known and understood, and who they are. And Kate will talk more about that and the importance of that in the context of this pilot shortly. So we are committed very much in our team to co-production. We've had for a number of years a parent carer participation co-production forum, and members of the national network are part of that, as are other groups and families. And as you can see, that was a really central and essential part of where our work in taking the words from the long-term plan and translating them into to action, where we went with this. And that was really the first place we went. We asked families, including those who'd had young people in inpatient settings, what this meant to them, what they wanted. And that really formed, along with a regional consultation process and talking to national stakeholders, that really formed an essential part of a stakeholder event where we brought together all of these points. But really the essence of it was really what families said they wanted and reflected their learning. We then, the Council for Disabled Children, then looked at existing roles and functions and did some research around that, commissioned by Health Education England, to inform the work and development of the key worker model. And that again fed into the stakeholder reference group that has parent carers, including National Network of Parent Care Forum members on it. That again went back to our parent carer participation forum, where we asked parents to define the outcomes that they felt were necessary for pilot areas to indicate success by, really. And those elements were really the words of the families. We took exactly what they said, and Kate can probably say a little bit more about this in relation to how it's been presented. But we really took exactly the words that families said they wanted, and we've used that as part of the outcome framework for measuring the success of the pilot areas. And taking all of this work, we then had quite recently an event where we brought together all of this and finalised documents, which has given rise now to the function guidance and all of the information that's gone out to the system. So families, I think, and I hope that this will resonate very much with you. So these are some of the things that families told us that they wanted and needed this model and all of this work to deliver. So children, young people and families should feel safe and happy, feel listened to and informed, feel involved in their plans, care and support, and experience a reduction in stress and uncertainty and an increase in stability. And those I hope you understand really, and they can resonate with you, because these were heartfelt discussions that we had with families, and they spoke from the heart, and they spoke based on their own lived experiences, and they felt that this was a tremendous opportunity for them to be able to influence something really positive and important that would help make sure that other children and young people and families had a much better experience and have really good lives. Children, young people and families should also have timely access to the right personalised, reasonably adjusted support. So we hear a lot of talk about personalised, but for this group of children and young people and their families, we really mean often quite bespoke, of very, very tailored support and thinking around their individual needs. Reasonably adjusted refers obviously to the Equality Act and the rights that children and young people with learning disability and autism have under that to reasonable adjustments. Assessment, care and support which is integrated. They also said was essential. Continuity of care and support as well. So reflecting that, there are often very complex issues and challenges in people's lives, and that's really important, not telling your story over and over again. Well-planned and well-managed transitions. So different types and stages of transitions between schools, between different life points, between childhood and adulthood. Implementation of care, education and treatment review recommendations. So this is something that was felt to be really important given their significance and their how vital and how successfully they do work for many children and young people and families. It was felt that the implementation of those recommendations is really essential and vital. And also outcomes which are agreed with them. So very much person-centred outcomes reflecting the needs of families, words not put into their mouths, but actually something meaningfully co-produced and very much valued and reflected around their needs. So all of this work and what you've heard in terms of the processes and how we took the words and really turned them into actions. So the work, as Kate said, and I'm part of this team, is led by the Children and Young People's team in the Learning Disability and Autism Directorate. That whole team is headed by Sue North, and Kate, who works in our team, leads this vitally important piece of work. The regional and national stakeholder events were led by the Council for Disabled Children, who had been commissioned for this piece of work by Health Education England. And their aim was to develop key working function, workforce competencies framework and key work function guidance. And Maruna has a copy of that, and no doubt that can be shared if it hasn't been already. So that's part of the suite of resources and frameworks that are supporting this vital work and these pilots. So as I said at the beginning, the pilots are focusing on children and young people at risk of admission or who are in hospital. So this reflects the words and the commitment in the original language in the NHS Long Term Plan. And I think I'm now going to be handing you over to Kate.
Actually, before we do that, Mary, could I move on to the COVID elements? There's a couple of questions coming in, one of which I think is appropriate for us to answer at this stage, which is really about the age range and scope of key working, as to whether it goes up to 18 or whether it also encompasses those going through transition to adulthood.
Really good question, and indeed I've asked that of Kate myself, and I think do you want to answer this, Kate?
It is something that we're looking at being clear about through the pilots. So we've not specified to regions who will be leading on pilot selection. We are welcoming pilots that work up to the age of 25 and include that transition, but they will have to bear in mind that the success metrics and the outcomes will be applied to all of those young people who are included as a result of that age range. But we are keen to understand how, through key working, we can really improve the experiences of people around the point of transition, because we know that's a point at which a lot of young people have real challenges and families experience crisis, and young people do go into hospital between the ages of 17 and 19 particularly. So yes, there is potential for it to be included.
And I think really, Maruna, I would just add to that I think that's a place really where perhaps our parent carer forums could influence. the pilot development. If you feel in your area that's something that really matters, it really matters to families, then please, that's something to have a discussion about. That's a really important part of the discussion and the framing and co-production of these pilot sites and what they want to do.
Thank you, guys. We've got another question here about the process of the pilots and co-production in that, but I'll hold that question for the time being, because I think that you may well cover it in what you're about to say.
Yes. So Kate, I think I was handing over to you now to talk about the impact of COVID.
So we did obviously go through the process that Mary's described in terms of consulting and co-producing the model. And we did have plans to develop pilots from an earlier stage this year, from April. Obviously, through the pandemic, the plans of all elements of our programme were paused, because all efforts obviously had to concentrate on the pandemic and no extra burden to the system. As all of the pieces of work that we're involved with nationally have had to go through a process of review and being revised in the light of kind of moving into a recovery and restoration phase. So we looked specifically with colleagues what the risks were from COVID in relation to the plans to be made about key working, and how we could account for them or allow for them in relation to key working. It was felt that through the feedback from all of our stakeholders, particularly parents, carers and families, that the key working pilot was really needed, that it would be a helpful offer to have at a time where all services were being really challenged. And bearing in mind that rather than having a 12-month period, we'd be reduced to a 6-month period potentially for the first pilots to operate, it was agreed that we'd raise the number of pilots taking place from 7 to 14. It was originally going to be 7 because NHS England divides England into 7 different regions. So now each region will have 2 pilots, or the funding to run 2 pilots for the remainder of this financial year. So the money for the pilots has been devolved directly to the regions. We have devised with co-production, as Mary's described, guidance for regions on what we're expecting from these pilots, and also we've provided guidance for prospective pilot sites on what they need to deliver in developing their model. And we've also devised an expression of interest pro forma, and these were launched with regions at the beginning of June to help areas start those conversations with all of their partners, including parent carer forums and parents, young people and families, to shape their model and be ready to put their expression of interest forward to their region. And each region is making the decision on what 2 pilots to take forward, and we're operating an assurance process just to check that all the boxes have been ticked. I'll come back to that in a moment. A key element in revising the plans was to ensure that there was an increased focus on making sure that dynamic support registers and dynamic support processes were either restored or developed to a point where local areas had got confidence that they were able to identify in a timely way young people who are showing signs of moving towards crisis or increasing distress, or behaviours that were challenging, that might mean that they were requiring additional support to avoid potentially an admission to a mental health hospital. We also felt it was important for pilot sites to outline plans to step down from key working, so that they needed to consider not only their model for key working, but also what would support families to step down from it. And that would probably involve working with their community, voluntary and charitable support networks, and understanding where they were at as a result of COVID. We also felt that the value of focusing on a key working function and competencies framework enabled recruitment potentially from a wide range of professional backgrounds. So rather than describing a role, which may well be a social worker or might be a learning disabilities nurse, we've described the work that needs to be done and the skills needed to do it. So potentially recruitment can come from a wide range of professional backgrounds in areas where there may be particular challenges recruiting from one professional group or another. And we've also considered that in the short term at least, pilot sites will need to have some consideration for virtual ways of working as we move to be able to manage face-to-face support again as we move forward. So moving to the next slide, Mary, thank you. So this really just gives you a high-level overview as to how the different bits of this sort of system fit together. So Mary and myself sit in the National Children and People's team, and we liaise with our regional teams who will be leading and managing the governance for the key worker pilots and helping us with the testing and learning and liaising directly with the local areas and supporting the selection process. So there's a clear line of support, challenge and accountability, and a clear line for communication and ensuring, you know, early learning in terms of the practice, good practice and outcomes. And we will be setting up a national evaluator and also a community practice for all pilot sites to be involved in. So it's really for local areas working with their region to really think about what is the most appropriate footprint for a pilot site to operate on in this first phase. So STPs are Sustainability and Transformation Partnerships, and they usually are on quite large footprints that may include a number of different local authorities and a number of different CCGs. Some of these are very large, some of these are smaller comparatively in terms of population, under 18 population, and also the different challenges and the different makeup of the local populations. For this first phase of pilot, we haven't specified what kind of footprint we are wanting to focus on, so that we can support pilots to get going as quickly as possible and to help us learn what this might look like as we go for wider rollout in the subsequent years. Thank you, Mary. I'm not sure whether there might be a there you go, thank you. So you'll have heard that there's reference to a key working function, but there's also reference to a key worker role. So thought it might be helpful to clarify that slightly in terms of what it means for yourselves as families, and also what it means for the pilot areas. So the wording of the long-term plan commits clearly to designated key workers. And so that's what we've got to ensure that we can show that has been delivered. In the consultation and the co-production work that has taken place, we've been able to describe what key workers should do, so the functions, and we've also been able to describe what knowledge, values and capabilities are required in doing that work, in delivering those functions. And as Mary described, we've been quite clear with what outcomes should be delivered from the carer, young person's perspective. And we've also described what needs to be in existence or in development in the local area to support the key workers in doing their role. So all of this is included in the guidance that the CDC has developed, and it's all included in the guidance for regions and prospective pilot sites. Now, as Mary referenced earlier, part of the work that the Council for Disabled Children did was to investigate where there were similar or emerging roles, to understand what works and how and where and what the challenges are. And so areas that had similar roles were included in this investigation, and it was found that whilst there were some similarities, none of the areas that were investigated actually delivered all of the functions that we've included in this model. In some cases, they did other functions that were really valued by families and were clearly seen as really supporting families and having positive outcomes. So it was agreed that by describing key worker functions, it meant that areas that had some offer currently in place could add to that offer and potentially develop a team structure to encompass what they had, but to ensure that they were also delivering what we're expecting them to do in the pilots to deliver on all of the key worker functions. So there is an element of flexibility, but the primary issue here is for pilots to deliver what we call additionality in terms of adding to the workforce and demonstrating that they are delivering the work that has been described, and for us to be able to then check that it has the outcomes that we're seeking and also meets the success criteria that we're looking for. So all of the pilots are going to be measured on children, young people and families having a named key worker where they are in hospital to support their smooth transition back to the community and the personalised support they need in the community. And those pilots will also be measured on those young people who are identified as being at risk of admission having a named key worker. So it's very much a part of the metric that you have a key worker, but how that is made into a model locally with existing support and services, there's an element of flexibility for local areas to work that through to best fit their current offer. Thank you, Mary. Moving to the next slide. So key working in pilot areas. So there's a clear expectation that these pilots must deliver real and meaningful change. And we've been very clear in what the outcome measures and the metrics are. And we are in the process of appointing a national evaluator. So each of the 14 pilot sites will be working with this national evaluator from the beginning of the pilot all the way through to really understand what value is being added, how the outcomes that have specified have been achieved, and of the other metrics that we've included, how they're shaping up in relation to those as well. So whilst I've described an element of flexibility for all the pilot areas, what we're really strong and clear on is that all local models must be developed in co-production with children, people and families, that there must be sign up from all partners, and by all partners we're meeting sort of chief execs sign off from the CCGs, Director of Children's Service sign off from the local authorities, and also sign off from the local parent carer forums as well, to show their support and involvement of the model that's been developed. We're asking them to be clear about what their workforce considerations are, and we're also asking them to describe how key working functions will be delivered. And as I mentioned before, the really important aspect of how will they support families to step down from key worker support, because we want that to happen at the right time and in the right way, but we need to have some concept of how families can move through key worker support and continue to be supported, but allow new families to benefit from the key worker role. Thank you, Mary. So the vision is clear in terms of the children and people with learning disability, autism, or both of the most complex needs will have a designated key worker. And the mission is to develop and support key working at a local level. So seeing this very much as a cross-system function, about how to build relationships and access resources across the system. So we're not seeing this role as one that sits in health or social care or education, but facilitates cross-working across all 3 areas. That's ensuring that there's an appropriate level of provision in place and accessible for young people when they need it, and that embedding support service to manage crisis and support community living, and also as a way of improving understanding of young people in the local area, understanding the data, understanding the gaps, to support improved commissioning of preventative services. So we've actually started on this process. As I mentioned, the expression of interest process was launched with regions at the beginning of June, and each region is leading on their selection process for 2 pilot areas, and they will be establishing what the timelines are and what the process is. So there might be some variation across the different regions nationally, but we've been quite specific in terms of the framework that they're using and what pilots are required to do. There is an assurance panel which is set up nationally for the 4th of August, where each of the regions will be bringing forward their 2 selected pilot sites, just to really have final oversight and check that those areas will be delivering what we need them to do, and also for our national partners from the Department of Education, Local Government Association, from the Association of Directors of Children's Services, to have an overview as well, to understand how and where there might be crossovers or opportunities or implications for work underway from their perspective. And then the plan is for areas to mobilise at pace to begin their pilots from October. So what local areas who are interested in becoming pilot sites should or are doing at the moment is developing that shared vision for how it will work across the footprint that they've identified, seeking sign-up from their local partners, including yourselves as parent carer forums, seeking support in co-developing and co-producing plans, and also considering really what the system requirements to support key working are like in that area, and what the risks might potentially be and how they need to be mitigated. And we are aware that there are, variations in terms of the risks that might be arising from COVID in different areas. They need to show how they have detailed plans for their finance and how this money will be used to expand the workforce and deliver the additional activity that is required in the key working functions. They need to be considering what their governance and leadership arrangements are, and each area needs to make sure they are fully committed to joining a national community of practice. And that national community of practice will be an opportunity for all 14 pilot sites to come together and on a real-time basis share from each other's learning and better understand different elements of how they work where, and so that they can be an ongoing approach to refining and developing the model as we proceed. Some of your colleagues on the webinar may well be aware already, but in each of the 7 regions there is somebody who is designated within the Learning Disability and Autism Programme as the Children and Young People's Lead, and these will be a primary contact point in terms of the regional work around selecting 2 pilot sites, and then engaging in the work moving forward. So we thought it might be helpful for you to have oversight as to who they are and what their contact details are. Most of these people have been in post for some time now, apart from those of you from the east of England. Hannah Mann only came into post on the 1st of June, but is quickly becoming established and is obviously fully started on this and will be very involved in the development of the work moving forward. So in each of the regions, as well as there being a children and persons lead, there is also a regional head of autism and learning disability who will also be having the responsibility and accountability for the development and selection of the key working pilots in their area, and obviously oversight of how the devolved funds are being used. So these are the regional leads, but I would suggest that it's the children and people's leads who would be the sort of primary source of contacts if you want to find out more about who might be the person to contact in your local area if you've got an interest in becoming involved in some way in a potential pilot in the area that you live. Thank you, Mary. Am I right in thinking? Oh no, we've got one more slide.
Yes, our big question. So I don't know,
Do you want
Maruna,
to lead on this bit?
Yes, well, I think we had a question at the end. Maruna, I don't know how you want to play the other questions, but we're very conscious about the key worker name, you know, being now widely used in the context of COVID, and it was just really a chance to seek your views. Sorry, Maruna.
I think what we might do before we move on to that, Mary, is we've had a number of questions, and I think it'll be useful for us to see if we can bottom out before we move on to your question, if
yes,
that's okay.
Okay, no problem. I'll move us on to that slide and then come back.
People would welcome some clarification. So the first, there's a couple of questions that are coming, and forgive me, I'm going to try. We've had a 7 or 8 questions come in, so I'm going to try and theme them. And forgive me if I do perhaps don't explicitly address your question, but I'm trying to put them together in a way that we'll be able to get through them all. First question is really around just a comment stroke around the process and the engagement of parent carer forums, which is that actually the timelines around this are very tight, and very often people and it's great that there is a lot of co-production baked into this, but some forums are commenting that with the timelines being so tight and quite a lot of other things going on at the moment, their capacity to engage and their ability to engage is tight. And so perhaps you could speak to that a little bit, and perhaps there's a plea really asking for basically saying, wonderful that we've got so much co-production baked into the process. Could we allow a little bit more time for that co-production going forwards? But perhaps you could just talk about the level of engagement that forums are able to give and what you expect from them.
Shall I start with that, Mary?
Yes, please, Kate.
We absolutely recognise that the timelines are tight, and that brings particular challenges for the kind of co-production that you would want to engage in. We were left with a decision as to whether we had pilots this year or not, and I think the overwhelming response from those people involved in the consultation was, you know, get pilots going, get the money out to the system and get the work started. So that's been our primary objective. It's important that areas that aren't necessarily ready to express interest as a pilot site this time round begin to think about what their model would look like and how they would co-produce that, because we'll be looking at adding to the pilot sites from April next year. So there will be some areas that aren't ready to put forward an expression of interest this time round that will have longer to engage in that co-production process. And as I say, we're looking to very much test. So there's an importance that there's clear involvement and engagement with parent carer forums and the local children, people and families in not just shaping the model to go out for the expression of interest, but in the continuing work. So this isn't something that stops once the pilot has been agreed. but something that we're expecting is a continuing relationship to sort of shape the development of the work locally in delivering the outcomes that we're expecting.
Yeah, and I just might add to that. I think that I totally support, agree with everything Kate said. And just to add, I mean, I think as well, it shouldn't, I know many areas and many forums already have, dialogues with their local areas, and in a way, this should be, a continuation of that, not something new, and also the most important thing is, as Kate said, it's the start of something that needs to be worked through over a period of months and years to develop this. These pilots are being used to help. Do you want to say something about that, Kate? Actually, the future, the 5-year plan, and just
yeah. So we obviously have a plan each year to widen and increase the number of pilots and to build on the learning. So to be clearer about what needs to be included in the offer and what it needs to look like locally, but based very much on the outcomes of the pilot sites and the co-production engagement within those pilots. So we have potential for 14 pilots for this year, but then increasing them with up to 3 to 4 per region next year, and then gradually rolling out and increasing up until the year 23-24, when we're expecting to have a full rollout in all areas of the country, in the way described in the long-term plan commitment, with those children with the greatest level of need and having a designated key worker. So all areas will be having the resource and a model by the end of 23-24.
Lovely. And can I just maybe add very briefly on top of that, is that we all know that parent care reforms are have varying capacities and also are under varying degrees of strain and stress at the moment at this very unusual time. And I think the plea from me would be, as a parent care reform, if you feel you should only be engaged as much as you feel you're able, and do not feel as if you're obliged to overextend. And if your local area is asking something of you that you feel uncomfortable with for whatever reason, that probably isn't co-production either. So feel free to set limits on your involvement as well, that you are able to support and be comfortable with. Can I move us on to another round of questions here, which are linked? The first one is sort of a segue between what we've just spoken about and the next set of questions, which is really, can you talk about how much is available for each pilot financially, and also then talk a little bit about the footprint of the pilot as to what you're expecting to see. Are there CCGs? Are there STPs? Who else should be collaborating in the pilots as well?
So the amount of money allocated for this first wave of pilots is 250,000 per pilot. So each region has been devolved 500,000 to manage 2 pilots. Now we have huge variation in the size of some CCGs and some local authorities. So at this stage, as I mentioned, we haven't specified what the footprint should be, but we're thinking along the lines of an STP or transformation partnership footprint that could potentially bring a number of CCGs and local authorities together. But say that's very much for local areas to be thinking about at the moment in terms of other considerations they might have around being one of the the first wave pilot sites. So we know, for example, that the STP, say from Hereford, looks very different from the STP in Greater Manchester. So there'll need to be some consideration in terms of the population size, the issues as to what that footprint looks like to make best use of the amount of money that's on offer.
And I think just to add to that they also need to deliver the outcomes that are promised, which I think for me, really demonstrate. I can really see, you know, the voices of all the families, including some of you, no doubt, on this call today, who've been part of developing that are really about improving the individual experiences and lives of families and individual children.
Thank you, Kate and Mary. I think that the key couple of specific takeaways or thoughts for parent care reforms there is that £500,000 per region. If your forum needs additional capacity, or if you need to, a part of that need to engage particular people within your forum to do specific pieces of work, then please make sure that any expressions of interest include money for your parent care forum or for the work of specific people in your area. And I think the second takeaway from that answer for us is, just as we are expecting CCGs to work cross boundaries across SDB footprints in this, then parent care reforms probably should be thinking about buddying up and working in collaboration with your local geographical neighbours as well. I think that would very much strengthen bids as well. Moving on to another sort of questions, much more this time, much more around who the pilots might be able to help when it comes to individual children. Firstly, a question around what about those children that are on waiting lists, who are not currently known to a service, or on waiting lists for services, particularly in relation to the question was about CAMS, but more generally waiting lists, who might benefit from a key worker. The second question really then is around where children are treated as well. So if a child is in a bed in a neighbouring CCG, or a neighbouring area, which area was responsible, you know, which pilot footprint would they fall into, the sending CCG or the CCG where they're being looked after? So a couple of questions about who might benefit from these pilots there for you, Kate and Mary.
Okay, so I'll take the latter part of that question first. So it's the child's originating area, so where they come from and where their family live, that would be the area responsible for including them in the pilot. So we know that some children are in hospital outside their local area. It would be their originating area that provided the key worker. So to support them to transition back to their home area and receive the right support and care in their community. In terms of waiting lists, this pilot, as Mary described, is focused on those young people who unfortunately are experiencing substantial challenge. And so we would be expecting them to be known to services. They may not be known to all services, so the process that is needed in that local area is a joined up way of the different agencies highlighting young people who require this support. So those young people who are on the point of needing a care education treatment review, for whom there is real concerns about them in terms of staying safe, or their families staying safe through the behaviours that they're experiencing, so that they could be known to education and not necessarily known to CAMS, but there would need to be a process in the local area for those young people being identified as being at risk.
I think, yeah, for me, I'd just add to that, I guess, that we also know, you know, looking at the stories and lives of families and young people who've been in inpatient settings, that they often don't get the right help at the right time. And part of this, you know, as well as we spoke about, is that we hope that systems will also learn and commissioning will be improved, especially where, you know, it's recognised that, you know, long waits and not getting the right help at the right time can contribute to those crises, and needing the care education and treatment reviews, or needing, you know, to go into inpatient settings. So just to add that.
Thank you, guys. I'm mindful of time, so I'm going to try and sweep up the last 2 or 3 questions stroke comments quickly, if I may. Firstly, there's a request that that perhaps you make contact with the Hillingdon Thrive network, which apparently been doing some work in this area. So perhaps one of the London LDA reps could reach out to the PCF in Hillingdon to make that connection. And secondly, there's a plea really here to make key working compulsory, in the sense that there's a sense that this has been spoken about for a long time, and I think everybody's very, very supportive of the idea in the Parent Carer Forum movement, but it, for whatever reason, just hasn't happened. So perhaps you could just comment on whether this is going to be mandatory or not going forward, and finally a question around whether there's going to be any work attached to this around the sufficiency and provision in terms of appropriate bed spaces for children who might need this sort of support attached to the key working. So really, it's a question really about whether it's mandatory, and a question about bed space planning for children with key workers.
I think the bed space is a separate issue, because key working is really about avoiding admission wherever possible, but in recognition that sometimes admission is the right and appropriate thing, but that we want that admission to be for as short a time as possible, and for young people to have the best support in transferring back to their local community, and not to then require to go into another form of residential care unless it's absolutely the best thing for them. So key working is very much a place-based community response to providing the right care for children and people as close to home as possible. It's not for this piece of work to really speak to bed sufficiency and beds being in the right place and offering the right support. That's for other elements of the work that we as a programme are involved in. In terms of it being mandatory, there is funds and a plan for this to be an offer across all areas, and I will take away the question to fully understand what the right response is, but my kind of initial thoughts and response are that I think most areas recognise that wherever they're at in terms of the numbers of young people that perhaps access mental health hospital beds, there is always more work to do in meeting the outcomes that have been defined through this work, and would welcome the opportunity of having some funds and a way of working in this way that supports delivery of those outcomes, and focuses on increasing the integration and coordination of services and the personalisation for children and people and families.
Brilliant. Thank you for that, Kate. I've left you 6 minutes to ask your question, so please go ahead, and we'll try and get feedback from the group.
Okay, thank you. And just to say, on the Hillingdon Thrive network, would really like to know more about that. And I guess, you know, this is the issue about the community of practice and the evaluation, that by going through this process and having that run alongside, you know, with the pilots and the community of practice and the evaluation, you know, we want to learn from and know if there are really good things happening, so that other areas can you know, use those. Do you want to add anything to that, Kate? That's a really important part of the work, isn't it?
And I suspect that some of the Hillingdon Thrive work was included in some of the work that the CDC did in investigating what was available locally. So I'm fairly confident has been taken into account, but as Mary said, keen to ensure that that good work and that learning continues to feed in.
Thank you. So yes, our question, thank you, Marunal. So as I mentioned, we all know with COVID that key working has been talked about a lot in relation to, you know, to jobs in, you know, who are, and people who are considered to be key workers. So we just really wanted to take the time to ask you today if you think the words from the long-term plan, key workers, key working, the name is okay. Do you think there might be confusion with the new focus because of COVID on key workers? And I think the final point was one for me, really, that I remember a time when we had key workers in the past with early support, but that key working wasn't really for children and young people with learning disability, autism, or both, and their families with the most complex needs. And that's something that, for me, this is so important about this work, that it's very clear, you know, what group of children and young people that this is for. So really would welcome your thoughts and views. Do you think it's a good name, we should keep with it because it's in the long-term plan, or do you think we should think of something else? And if you've got ideas for what that should be, we'd be really grateful. And I'm sorry we haven't got a poll button, but if you've got anything you want to reflect.
Some of the suggestions that are coming through here are care coordinator. An agreement around the fact that, yes, it is slightly irritating. The key worker phrase is one that we've used for a long time, but it seems to have been taken over by something else. Another comment, maybe lead professional, care navigator, coordinator, family care coordinator, family lead. So these are all suggestions, but also comments that actually the profile of key workers more generally, that the term key worker has actually, although it does mean different things, has gained in currency over the last period as well, that we're certainly recognizing the importance of our key workers. Family guide is another suggestion.
Okay, well that's really useful. If you've got more to share, we'd very much and be grateful to hear them. And if there are any questions that we haven't been able to answer today, we can answer those, or do our best to answer them through a Q&A. Maruna, would that be okay, to make sure that we have?
Fine, yes. But I think we've largely covered the big themes that came up in the questions today. So well done. Oh, family liaison, another suggestion.
Okay. Well, I just wanted to say a thank you to all of you for your commitment to joining today. As a family carer, I appreciate and know how, you know, how what a commitment that is. So I just wanted to thank you all for joining. And I don't know if Kate wants to say a few words.
Just to echo those thanks, thank you for taking the time and showing your interest and support in this piece of work. We are committed to implementing it in a way that we hope will make the best difference.
And just to say, we work very closely with Maruna and all your National Network of Parent Care Forum colleagues. So if you've got any thoughts or ideas on more you would like, more information, then please let Maruna and his colleagues know.
Okay. So I think I've got the privilege of saying thank you to Mary and to Kate for what I think was an excellent webinar, really informative, and also a final thank you to everybody who joined, because and for what I thought were frankly excellent questions, really incisive questions. With that, with 1 minute to spare on the hour, what I will do is I'll close the webinar. Thank you, everybody, and goodbye.